not from restaurants that are all social distancing. The problem is not retail outlets. The problem was massive groups of people throughout the country not socially distancing, exposing themselves. So the average age right now of the new cases that we're seeing is about 31 years old. Those are the folks that have an easy time with this virus. Hi, my name is Dr. Jeff Barke. I'm a board-certified primary care physician. I've been in private practice for over 30 years. Looking forward to talking with you today about some of the COVID-19 realities and myths.
Let's do this. Do you want to explain what this is?
I will. So we've got a FDA authorized antibody test that tests for two things. Antibodies from the past, were you exposed to COVID-19 and are you now immune? Or current antibodies, is your body actively fighting off an infection? So that's IgG, memory antibodies, and IgM, current acute antibodies. So it's a finger stick test, and the results are in about 10 minutes.
I'm horrible at these needle things, anything like this, but I'll be fine.
This is a painless lancet. Oh my gosh. Close up of Will to see if he's crying.
I'm about to. That wasn't so bad.
Right? Only takes a little drop of blood. It's red, folks. It's red. Can you see that?
I do have red blood.
It's amazing. Draw a little blood.
And now people are coming in. You do this in like people's cars when they come to the.
Usually not the finger stick. So you hold that and put a little pressure on it. And now we get results in about 10 minutes. Actually, it's usually a lot quicker than that.
And it will tell me whether or not I have the antibodies.
It will tell us whether or not you have antibodies, either memory antibodies or acute antibodies, meaning that your body is currently fighting something off.
Okay.
So we'll set this here. All right, we'll let that sit there for a few minutes and we'll find out.
Do I have like tape or anything? Or I just got to keep.
No, you just hold it for maybe a couple minutes and then you're good to just throw it away.
Okay, cool. Yeah. Well, I would shake your hand, but now I can't shake your hand. We have to do left hand.
Yeah, left-handed shake.
But I really appreciate you being here, Dr. Barke. Gavin Newsom in California just said now we're going to shut down the restaurants again in a lot of California counties. Is this a good move that they're trying to shut down the economy again?
You know, I think it's a terrible idea. We have to remember that initially when this virus came on, we were told we were going to shut down the economy temporarily. And the purpose of doing that was to so-called flatten the curve. And the idea was that we were worried about healthcare capacity, in particular New York, for a time in New Jersey, for a time even up in Seattle. The hospitals seemed to be overwhelmed by cases of COVID coming into the hospital. We're going to shut down the economy, let healthcare capacity come back online, then we would open up the economy. Well, that's happened. There's plenty of healthcare capacity now. We know a lot more about the virus, who gets it, how to treat it, who's at risk. So there's no reason to continue to shut down the economy. What a healthy society should do, and this is what we've done historically in the past, we should protect the most vulnerable, older folks, nursing home patients, extended care facilities, and those with significant pre-existing conditions. So we should protect them. Then folks that are sick, we should isolate or quarantine those people, but the rest of us, the young and the healthy, we should go about our business. There was never an expectation that we were going to prevent people from getting COVID-19. The deal was people would get the disease, but we want to mitigate the hospital problem, the hospitals being overwhelmed. There's plenty of capacity in the hospitals. What we're seeing now with increased cases doesn't mean increased hospitalizations. That doesn't mean increased deaths. We're seeing increased cases as expected. This is not a surprise. We shut down the economy, now we opened it up, so people are going about their businesses, back to restaurants, back to retail, back to shopping, and they're going to get exposed to the virus, and that's okay. We want to protect the most vulnerable. The other problem that we've seen is we've had massive protests across the United States and rioting. Thousands of people in almost every single state, almost all of whom were in close proximity to each other. Many of them were not wearing masks. So of course, a few weeks after these protests, we're going to see a spike in cases. That shouldn't be a surprise to anybody. The problem with the spike in cases is not from restaurants that are all social distancing. Almost all of those restaurants now are requiring masks. The problem is not retail outlets that also require social distancing. The problem was massive groups of people throughout the country not socially distancing, exposing themselves. Now, the good news is, as I watch those videos, you don't see too many 65-year-old or older in these protests. It's almost young people like you. So the average age right now of the new cases that we're seeing is about 31 years old. Those are the folks that have an easy time with this virus. As a matter of fact, it's almost hard to calculate the fatality rate of people that are young that get this virus. There's so many zeros after the decimal point that it's hard to calculate. CDC just yesterday came out and said the fatality rate in total is about 0.4%. What does that mean? Well, in comparison to influenza, that is somewhere around 0.15 or 0.2%. So the overall fatality rate, at least based on current data, is higher than influenza. But what we're seeing is every week, as we do more testing, as we get more data, the fatality rate is dropping. And the fatality rate for a young person is way below that of influenza. As a matter of fact, a young person has a less than 25 years old, you have a 50 times greater risk of dying from drowning than you do from dying from COVID-19, and a much higher risk of dying from an automobile accident than you do from COVID-19. We're not closing swimming pools. Don't give Governor Newsom any ideas. And we're certainly not shutting down the freeways. As a matter of fact, me driving out here today, one of the advantages of what's going on right now, no traffic. That was awesome.
Yeah, that actually is the best. But now traffic's starting to start up
a little
again
bit.
Because,
it's still not as bad.
You know, because they were opening the economy open again. Like you said,
Exactly.
restaurants are opening, which is also funny because every single restaurant I've gone to, they make me wear my mask and social distance.
Right.
It's definitely not the restaurants
It's
really
not the
giving
restaurants.
things. And they were starting to open things back up, and now they want to close everything down again. We saw an increase in cases in places like Texas and Florida. And they're saying right now Orange County as well.
Yes,
Are the
yes.
hospitals overrun in these places?
No, they're not overrun. You know, obviously I know my hospital system the best, and that's Hoag Hospital. They're not overrun. So what's happening, if you and I walked out of here and you fell and hit your head and you ended up in an emergency department, they would test you for COVID. And if you were to test positive for COVID, even though you have no symptoms, you're now a hospitalization for COVID-19. That's what we're seeing. In addition, we've now opened up healthcare facilities for what was previously shut down as considered non-essential. So somebody now going in for shoulder surgery or knee replacement surgery or whatever it is automatically tested for COVID-19. And if they're in the hospital and they test positive, it's a hospitalization for COVID-19. So we're seeing less emergency room visits for acute illness. We're seeing less ICU admissions, that's what I mean. We're seeing more people coming into the hospital for the elective procedures and so forth that were previously deemed non-essential. And the length of hospitalizations for COVID patients is dramatically reduced because we're a lot better at treating this.
In terms of the masks actually like helping stop the virus, what are your thoughts on that?
You know, I don't want to get too controversial. The mask issue has really been beat up. My personal opinion is masks have very little utility in preventing the spread of the virus. For starters, most people have no idea how to wear a mask. So if you just watch people with their masks on, notoriously, every 30 seconds, they're touching it, they're adjusting it, they're scratching their nose. And as soon as you do that, you render the mask basically useless. In addition, there's been several studies, not for COVID, but for influenza and the common cold, looking at the ability of a mask to prevent infection. The conclusion was they don't work very well. Nobody's done studies on COVID yet, but we're speculating that if you wear a mask, it may offer some protection. And we believe that there's some false sense of security by having a mask over our face, even though there's very little scientific evidence to support that.
Is there data to show that if I am at the grocery store and I see that old woman and I don't have my mask on, that I'm more likely to give it to her?
Well, the data shows clearly if you are ill with the virus and you sneeze or cough directly in her face, that's how she's going to get the virus. There's little data to support asymptomatic spreading, meaning that you've got the virus, you have no symptoms, and this visual of people walking around crop dusting the population because you have the virus but don't know it just isn't accurate. So if you're sick, don't go to the grocery store. And if you're sick, putting a mask on to prevent your spread to others is not going to help that much. The best way that you can prevent the spread to other people if you're ill is to stay home. The example I like to give is I've got a patient right now who's suffering from stage 4 breast cancer, and she's finishing up a course of chemotherapy. As a result of the chemotherapy, her immune system is beat up. She's much more susceptible to getting infections because her immune system is beat up from the chemotherapy. So what we don't do in her situation is tell all her neighbors in her neighborhood to put a mask on and to socially distance. What we do is to tell her to be extra careful. She stays in her house. When she goes out, she's extra careful. She might stay away from people because she doesn't want to get an infection because her immune system is susceptible to that. We don't tell the total neighborhood to put masks on. I mean, that's ridiculous, but that's exactly what we're doing now. We've got a virus that isn't much more lethal than a bad influenza outbreak. Yes, it's contagious. Yes, there's a lot of people with it, and it has caused a lot of death. No question about it. But we know about 50% of those deaths are in susceptible people that are older, nursing homes, and those with significant pre-existing conditions. And the longer this goes on, the more we're realizing that the young and the healthy are relatively immune to this virus. They do well when they catch it, they recover quickly, and they don't die from this virus. In children, they're so immune that they have a greater risk of influenza than they ever did from COVID-19, which is why, by the way, I'm advocating open up the schools with almost no restrictions. We got to get the children back in the classrooms.
That's what I was going to ask you about.